Monday is World Mental Health Day.
Yeah, kids today face so many challenges, right? At home, school, online. So we are now joined by clinical psychologist Anthony Pugliafico. He's an associate professor at Columbia who specializes in child and adolescent psychology. So thank you so much for being here, Professor. Good to see you.
Thank you so much.
And this is such an important topic. So what is, I guess, the biggest mental health problem that you see specifically with children in your practice?
Well, first of all, I'll just start by saying how important a topic this is today. The earlier we can identify challenges in mental health with our kids and teens, the more effectively we can help them. We are certainly seeing increases in depression and anxiety, more severe mental health concerns. Over the last 2 decades, we're seeing increased sadness and hopelessness, and all this is leading to increased demand on, certainly at our services in Westchester and throughout our mental health system. So all of these are really vital concerns for us to be addressing for our kids and teens.
Right. And Professor, with so much going on, what signs should parents be looking out for in children who are having possible post-pandemic issues, perhaps issues at school with their friends or even at home?
Yeah, no, that's a great question. There's a number of things that parents can look out for, and COVID certainly didn't help in terms of the challenges our kids face. One thing I would be looking for is your child avoiding or withdrawing? When we're depressed, we withdraw. When we're anxious, we avoid. So if you see your child pulling back from activities they like to do, activities they need to do, like school, if they're pulling back from friends or family, that can be a sign that they're struggling. Changes in sleep or eating are also important, as that they're tied to our mental health. And irritability, really increases in irritability or shifts in mood can be an indicator of increased depression or anxiety.
Yeah, and we're talking about, you're talking about some of these things that are post-pandemic, but did the pandemic itself create some new problems for children?
Well, the pandemic, I think, certainly worsened challenges that were already there. Kids experiencing loneliness. Kids were experiencing loneliness during the pandemic. That only worsened during COVID, and we know that loneliness is a risk factor for depression and other mental health problems that our kids face.
Yeah, and the reason I ask that is because sometimes, there's, in adults, you have this reintegration back into society and group events, and you're like, well, how do I act? And then it creates this whole psyche of, am I doing things right? I forgot how to talk to people. And I wasn't sure if children were experiencing the same things, because we get in our own head.
Yeah, and we've seen that certainly with some of our kids who are more vulnerable to anxiety. They didn't have the same demands placed on them, being home and not around other peers that they did pre-COVID. So that challenge has been really reintegrating and showing back into the world. So that's been very difficult for a lot of our kids and teens.
Right. And we know it can also be difficult to parse what is just a natural transitional phase for a child and what's actually a behavioral issue. We hear so much about children on medication for things like attention deficit, hyperactivity disorder. Do you think we are putting kids on medication too soon?
Well, I think I'll say that many kids do really benefit from medication, and medications are some of our frontline treatments or helpful treatments for mental health concerns. That said, there are also behavioral treatments that are helpful, and I think the best advice I can give if a parent or child or parent is concerned is to really speak with your pediatrician, a trusted school staff, or a mental health professional to understand what are the best supports for your child.
And what's always annoyed me is this stigma around mental health and the ability to talk about it and talk about it freely without, this negative connotation around it. How has that changed, especially within schools, when it comes to the conversation around mental health? Is the stigma still attached? Is there more of an effort to push this forward and let people know it's okay to talk about?
Well, the fact that we're doing this here today is wonderful and certainly a step in the right direction. We've seen schools increase conversation amongst parents and amongst students about mental health. We see increases in wellness, and I think all of those are steps in the right direction. We've got a ways to go, though. That's why spreading the word about the fact that we all experience challenges to our mental health here or there. We all have mental health. And so being able to talk about that and be able to kind of share when we need help is so important.
Yeah, like you said, it's great we're having these conversations, but still a long way to go. So do you think there's a substantial number of kids who need this help, but they just aren't getting it?
Absolutely. Absolutely. There are many children who we haven't necessarily identified as needing help. And I think that the more we're talking about warning signs, as well as what parents and caregivers and adults can do to support kids, the more we're going to be able to get the help to the kids who need them.
Okay, well, thank you so much for being here today to talk about this and for talking about it freely. I appreciate you being here on this World Mental Health Awareness Day. It's very important to chat about.
Thank you so much.